Welcome, everybody, to Taylor Tuesday. Today is November 11th, and I'm just like to welcome everybody for taking time away from their family. I know they've probably had a long day at work, and the last thing they want to do is be on a webinar. I want to tell you a little bit about Taylor Medical. We did these webinars for almost 3 years, once a week. And then I think people started getting webinar out, and we curtailed it for a little while. I've just recently brought it back. And this is our third webinar in the series. Taylor Medical is a podiatry GPO. We were started by physicians, owned and operated by physicians. All of our staff have worked in the podiatric space for their careers. Our goal here was to build a family, not just a company. We knew that we wanted to solve some financial issues that I think problems we're having in today's environment. Reimbursements were going down, costs were going up, and we needed to figure out a way to try and do something that would help. And we also wanted to be able to give physicians the ability to implement new things into their practices, and not just sell it to them, but educate them on how to use it. We didn't know that we would become the nation's largest podiatric GPO. We have been giving back to the profession our whole existence. We've funded 2 scholarships to the Educational Foundation for future podiatric students to get educated and trained and graduate. It's called Giving Back. I think in some ways we should all try and give back as much as we can. So I'll tell you that anybody who purchases and uses Taylor Medical is giving back because we're giving to the future of the profession. We've partnered with over 30 vendors. We vet all the vendors. We feel that they have something to offer, and they believe in our belief. It's not just a matter of selling what we need to sell. It's a matter of educating and training. Case in hand, tonight we have Vista DME. They're a new company that's joined the Taylor family, and I think that they have a huge thing to offer and educate and train on the dispensement of surgical DME products for your patient's practice. A little bit more about that later. But I think that what I want everybody to understand is that we're here, and when we do this, we want you to think about Taylor Medical, anytime you're going to do something for your practice. I don't care if you're ordering bottled water for the treatment for the waiting room. I don't care if you're getting peanut butter crackers for a diabetic patient whose blood sugar drops. I don't care if you're getting copy paper, anything that you need. I hope that you reach out to Taylor Medical and give us a chance to provide those things for you. I think there are a lot of advantages to membership. The most important thing is we don't charge anything for the membership. We want to be your facilitator in dealing with the vendors. Instead of your staff having to waste time communicating with 30 vendors, or however many vendors that you're using in your practice that are Taylor Medical vendors, we can help facilitate things. We've developed prime vendor networks with industry-leading manufacturers. We try to give you practice growth tools, like we're going to learn tonight about how you can modernize and streamline utilizing DME wound care surgical supplies. We provide you with clinical support and education. We give you a free subscription to a ordering platform so that you can manage the medical supplies in your office, making the job for your medical assistant significantly easier. Excuse me. We're physician-owned and operated. Jeff and I are both deep-rooted in podiatric medicine. Our staff have worked in podiatry clinics. Everything that we've done here is to try and make things better for our colleagues. As I said, tonight we're featuring Vista DME. Be very candid with you. I wish Vista DME was practicing when I was in practice, because it would have made my life a lot easier. It's a full service management solution encompassing products and services that simplify every step of a provider's DME wound care program. They help you source the products. They help you manage the products. They make sure that your documentation is correct. They make sure that your paperwork is accurate. You can track an order from soup to nuts, from the day you send in an order form to any type of benefit verification, prior authorization that needs to be done. It's a comprehensive and efficient support system. It'll make your teams life a lot easier and allow you to provide the care that you need to your patients. Joining us tonight is Ryan Forstoff. Ryan and I have actually worked together longer than we actually remembered that we did until we started talking to each other. During COVID, Ryan was involved in helping me with a couple of other projects. In fact, up until recently in my phone, I didn't even have his correct last name. I had him by the name of the product that he helped me source. Anyway, Ryan is a longtime business builder. Over the last 25 years, he has been a member of founding teams that created companies to solve critical needs in healthcare, institutional finance, and sustainable agriculture. Ryan's teams have distributed innovative pharmaceutical therapies, novel diagnostics, and most recently been involved in the acquisition, advancement, and distribution of a potentially new standard of care dressing in the wound care space. At Vista, Ryan is responsible for the company's operational excellence, service advancement, and expansion of service offerings to clinics across the country. Ryan, I want to thank you very much for joining us here, and I really appreciate you taking the time to teach our members about Vista. Thank you very much.
Ira, thank you for having me here. Thank you for allowing Vista to be part of Taylor Tuesday tonight, and more so, thanks to you and to Jeff for all that you guys do with Taylor. I know that you continually work to provide good information and good solutions to your members. And it really is an incredible effort. And I know that the members that are here tonight and the members that are not here tonight are all grateful for the work that you and that Jeff do. I guess for the sake of background and context, what I would offer is that our team here at Vista, we've been deeply involved with physician practices across the country for the better part of the last 2 decades. And over that time, we've worked with different specialties on many different programs, as you said. But in all of our work, we've always tended to focus in 3 main areas: supporting clinics as they roll out and manage ancillary revenue programs, supporting clinics as they roll out new or novel therapies and diagnostics, and also just helping to streamline the clinic workflow from anything on a software system all the way to a staffing model. And I tell you and the audience tonight, I tell you that to say that at our core, we believe that our role at Vista, and for each of us within Vista, is to support physicians in all of their non-clinical requirements so that you, the physician, can focus time and expertise on patient care. And Ira, as you and I sort of talked about tonight and about the members that are here tonight, these podiatric clinics across the country, I couldn't help but think about how the shift in our population here in the United States is increasingly putting the podiatry clinic right at the center of care. And I say that because, as your members are fully aware, we are an increasingly obese population. And I realize that not everything we do in wound care is about managing obesity, but for the sake of this conversation, there is an increased percentage of our population that do struggle with diabetes, that do struggle with an increasingly insufficient vascular function. And that's a population that largely does not heal post-surgically the way that we used to. And all of this sort of feeds the need for better and better chronic wound management, and this notion of conservative care and the notion of DME wound care. So for us, I think it's created a new situation in the clinic. It's created a renewed focus on caring for diabetic foot ulcers, for venous leg ulcers, and again, focusing on improving post-surgical care for wounds. And I think, as I mentioned a second ago, broadly, we talk about chronic wounds with that notion of surgical healing, post-surgical as an exception. And more so, we talk about managing chronic wounds that are increasingly plaguing our society. And that is becoming a core medical function of the podiatry clinic. And that work of managing chronic wounds from an outcome standpoint also becomes a critical revenue stream for the clinic when it's well managed. And I think we've certainly seen it, and I suspect folks on the call tonight have seen it. When it's poorly managed, that notion of providing chronic care those first 30 days to the patient at home it can become a real headache for the clinic. It can create stress. It takes time demands that the clinic was not set up to accommodate. And that really was something that, as we developed Vista, we sought to fully understand and then to develop a solution that would address. Um, so I think that as we began to structure the solution, we wanted to structure a solution that was truly comprehensive, that was indeed software based, um, and that would be an immediate and sustainable assistance to clinics that are delivering this chronic wound care. Um, so I think kind of to sort of jump right into what we saw, more or less across the board, we continue to hear, and we heard early on, I would say 5 big problems that come up again and again and again. Number one is the notion of insufficient chart notes and documentation. This idea of performing a chart note review, making sure that all of the information is accurate and that it's consistent. Um, that tends to plague clinics. It is traditionally a challenge, and it's not the same challenge, the same level of challenge to every clinic, but it's consistently an issue. I think the second thing that we saw was this notion of the importance of benefits verification. Having a skilled team that could perform the verifications, that can do them quickly, that can do that in a way that does not bog down the inner operation of the clinic day to day. The third thing that we heard, again, when you're talking about managing all of the supplies that go into delivering conservative care, delivering those wound care therapies at the patient home, is the notion of managing inventory and supply chain. Whether a clinic manages that inventory on site or through a third party, if a clinic is overseeing any high volume of inventory and any broad number of SKUs, it just becomes a logistical headache that most clinics are not set up to do, Ira. And I think number 4 of 5, let's assume that a process was fulfilled all the way through successfully and that a package of supplies was actually shipped to a patient. The clinic is now in the business of customer support, calling customers, making sure that a product has been delivered, making sure that the patient understands what each of the supply items are in that box, that they understand how to apply them and how to use them. So, with all of those challenges that we sort of consistently heard from clinic to clinic as we put the program together, we wanted to build a solution that addressed all of that. And what you can see here is sort of a summation of the 4 areas that we sought to solve for. We wanted to create, automated benefits verification. We wanted to streamline supply. We wanted to make sure that we helped clinics optimize revenue cycle management, and that we created something that would give you, as a clinic, as a business owner, a really robust and comprehensive set of data analytics. And when we talk about Vista DME, we're talking about a comprehensive solution for managing DME wound care in your practice. It is a software-based end-to-end solution that allows you to have an immediate impact on your patient outcome, and that is primarily through a more efficient and a more effective delivery of those conservative therapies, and an immediate impact on the clinic performance. And again, it's by making it easier for the clinic to prescribe, to deliver, to bill and collect for all of these conservative care therapies. And I think, as I've alluded to a couple of times, we've sort of come to understand the realities of delivering and managing conservative care therapy from the clinic. And we have seen the struggles, from proper documentation to managing inventory to fulfilling shipping and logistics, all the way through to completing the billing. So for us, Vista is a complete solution that's designed to address all of the logistical challenges. And, you see here sort of on this slide, a bit of a summation of what we've talked about, really addressing all of the items in a step-by-step process that are required to deliver that care in the clinic. And the idea is, we want to allow a clinic to practice medicine, and we'll handle the logistical headaches and the heavy lifting of that part of the process. part of what goes into all of this, though, is making sure that we do have a robust inventory of products. It would not be a comprehensive or a complete solution for a clinic if we gave you a great software package and a great support team for benefits verification, for chart note review, for customer service, if we didn't also give you a comprehensive set of dressings, alginates, gauzes, tapes, wound wash products, things that you use day in and day out in the practice that are practical for that care. So with that in mind, I think the question then becomes, what is Vista? How does this work? How much of this is process? How much of this is people? How much of this is software? And if you look at this slide, Ira and folks here on the call tonight, this is a very simple explanation of what we want to do. We've designed a process, and again, it's software based, and we're going to get to that software, to facilitate a very streamlined, very simple, very clean way for you as a clinic to submit a written order, to make sure that all of the documents that accompany that written order are complete, they are compliant, they meet the codes. We want to make sure that once that order is processed, you as a clinic have complete transparency and visibility into the status of that order. Has it been shipped? Where is it in delivery? Does the patient have it? And then again, we want to be sure that you have access to all of the notes and all of the products that give you a sense for the status of those orders in the clinic. So I think, at this point, it's probably useful to give you a very quick glance at some of the primary portions of the software itself, where as a clinic, you are likely to use the product as a software piece. So on the screen now, what you see is just kind of our broad dashboard. Kind of think of it as a business management viewpoint. This gives you a very clear sense of the status of your orders, kind of how they're progressing through time, and a distribution of the orders in each of the statuses. Again, this is sort of a high-level dashboard view. And if at any point in time, any of the audience members tonight wanted to take a deeper dive one-on-one into the portal and go through a full demo, our team is happy to do that with you guys. If we go forward a little bit further, obviously, as we spoke, the notion here is that we want to give you guys a very clear way to submit an order right from the outset. There needs to be a very user-friendly approach to describing wound number 1, describing wound number 2, describing wound number 3, outlining the types of dressings and the types of solutions that you want included in that order. And then once that order is submitted, again, it should be a little bit out of your hands and into ours to see it through to the next steps. Part of what you're going to want to be aware of is any deficiencies in the chart note, any of the notes that were sent through, any of the diagnostic codes. That's kind of one of the most valuable pieces that we're able to offer as a service. So the software will pick that up. Our team will review all those notes. They'll immediately send back notes to you guys in the software, as you see here. It can also be communicated in other ways as you tell us, clinic by clinic, provider by provider. I think, again, you also want to be able to get a sense for any place else in the process that an order may be stalled, if that's an insurance verification, if it's in patient responsibility. So again, you're seeing another slide here that gives you an example of another stage in the process within the software that further communicates with you guys the status of that order. If we move on to take a broader look at overall the status of all of your orders at any given time, this screen gives you a handful of orders. You can get a view for the patient, the products that were on there. Off to the right, you can get a sense for any orders that are on hold. Is there a HCPCS issue? Is there an insufficient chart note information issue? Is there an insurance problem? So you're going to have kind of a constant access to what, if anything, is holding up a given claim. If we drill down that on a little bit further, off to the right, you see that we've now highlighted a very specific claim. And claim by claim, you could actually pull up, what is the tracking number? Remind me again of what is on that order. What does my proof of delivery look like? Is my Form 1500 there? Are all of my chart notes there? Has the patient responsibility been met? Again, it can be as detailed and as drilled down as is necessary for you guys to see what you need to see on each of these patients and on each of these orders. Here, again, just to give you a quick example of the kinds of documentation that do get stored in the portal patient by patient. You're looking at a piece of a 1500 form here. Again, when a record is complete and an order has been fulfilled, you guys will have immediate access to all of the documents necessary to submit that billing documentation. You'll have a proof of delivery. You'll have an invoice for the product. You'll have a 1500 form. All the chart notes will be complete. All the insurance information will be there. And again, the intent tonight is not to take you through step by step each small portion of the portal, but to give you guys just a broad overview of the portal itself, and more so about the process and the thinking behind the comprehensive solution that we built with Vista. Ira, I think you're talking, but I think you may be on mute, and I know it looks like there's a couple of
Oh,
questions already starting to come in.
they are, and thought I unmuted myself, but I had a little tag that popped up that said you're muted, and I hit it, so I guess it didn't work. Anyway,
No problem.
I wanted to thank you very much for taking the time to explain everything.
It's a
As I
pleasure.
said earlier, I wish something like Vista was around early in my practice career. Did a lot of surgical dressings, a lot of wound care, and I will tell you that for those of you who are aware, surgical dressings are one of the most audited areas by the CMS at this point right now. 35 to 40% of all of the claims are audited and reviewed, and Medicare claims that they've been paid inappropriately. So having a tool like this, to me, and I've looked at a lot of different portals. This is very comprehensive. It does a lot more than what I've seen. I'm going to start reading the questions, but I want to tell anybody else if they have any questions that they would like to send, please send it in the chat box. Go into webinar chat and put any questions in there. But I'm going to get right to the start of it, Ryan, and put you on the hot seat if you don't mind, because that's what I like.
Sure, go ahead.
Because I enjoy. I very rarely do I have any control of you. Usually you're giving me down the road, so I'm going to give it to you back.
Fair enough.
So this looks like a very comprehensive solution. I know that I can speak definitely for maybe my own contemporaries. Sometimes the technology is very fearful. Everybody's worried about the drain on the staff. How long does it take Vista to train your office staff and to actually get a program implemented so that you can provide care to your patients?
Yeah, I'm going to answer that question, Ira, and I'm going to respond to a comment that you made. Look, I think that software can be a really intimidating thing, and the notion of portals can be an intimidating thing. We spend a lot of time designing and developing a software that is very, very user-friendly. It's very intuitive. It is truly very easy to interact with. And I think that's something that we continue to focus on and continue to improve upon. From an actual training standpoint, look, it is a very simple process and a very simple system to understand. It may take between an hour and a half and 2 hours to actually deliver a training. And we can deliver that training usually within 2 to 3 days from the execution of a contract.
Awesome. So there are so many different EMR programs that physicians are using. And there's always this complicated issue with, if I'm going to use a product, how do I know that it's going to work with my EMR? How has Vista been structured, and how is it a smooth transition into any EMR that our colleagues are using?
That's a great question, Ira, and it's something that we get asked all the time. And I will tell you again, just from a beauty of the software, we designed this to accommodate any EMR. So truly, we are EMR agnostic, and we can work across the board with all providers.
Okay. So I've got a question to ask you. Another one. They're starting to come in here. Can you order these supplies for customized days, or is it just 15 or 30-day supplies?
No, it's a great question. So we have, again, over time, continued to respond to what our clinic customers ask for from us. We did early on think that it might be appropriate to offer things in more of a fixed setting environment, a 15-day product, a 30-day product. And what we found is it is better for our clinics if we offer more flexibility, both in the number of days and in the products that get included. So this is truly an a la carte offering as best suits the clinic. And certainly in a clinic by clinic case, there may be 2 or 3 or 4 combinations that you most commonly will write for. And, we can set those up as favorites so they very quickly will populate your written orders.
Awesome. So, Ryan, you talked earlier about benefit verifications, talked a little bit about finances. I know that from when I practiced, one of my biggest concerns, and I think I told you earlier that I couch a little color around each of the questions just to make them straightforward. But I guess the bottom line is we're busy in our practices. Our doctors our colleagues are seeing a ton of patients. Who reaches out to the patients regarding their out-of-pocket amount? Is that Vista? Is it the practice? Is that something that is a coordinated effort? How does that work?
Yeah, it's a great question. It absolutely is a coordinated effort, Ira. We have set the business up so that all of that at the clinic's discretion can be fully handled with our team. If a clinic chooses, they do not have to contact a patient. They do not have to have that ongoing interaction. We have a qualified staff that are happy to do that. But again, on a clinic by clinic basis, or even on a provider by provider basis, certain folks may prefer to do some of that in-house, and certain will prefer that it all be handled outside with us, and we're happy to accommodate either.
Okay, what happens if one of your DME claims is denied? What do we do?
It's a great question. It's a very common question, as you would imagine. Clearly, this is an ancillary revenue item, and it is something that we want to be very attentive to. So I'm going to go back to kind of the beginning of the process, Ira. Our intention is to minimize denials by making sure that through the process, we capture all of the information that is necessary in the written order, in the chart note, through insurance verification, through all of those steps. So in theory, and what we've seen is that our offering will minimize denials and certainly will minimize avoidable denials. We will work very closely with you on any appeals as are necessary. We can go through that process. And to the extent that we really reach an impasse, we do have an assurance program in place to minimize cost to the clinic.
Ryan, can you explain what an assurance program is?
Yeah, in short, Ira, it is a way to ensure that the clinic does not have a certain degree of financial risk for those supplies cost.
Okay, so this is a very interesting question that we just got.
Okay.
The question is, because I know that you've talked mostly about insurance, medical necessity, qualifications. How could I use Vista for my patients if I have only a cash practice?
That's a great question, Ira. So I think that in that case, let's go back to our initial intent and our primary objective here. It is to make sure that we deliver high quality, excellent outcome patient care. So I think then you would build back from what is our intent. We want to be sure that we provide that patient with the most efficacious products for the treatment of that wound at home once they've left the clinic. So in that case, we will still be offering the full set of SKUs in the inventory for product. We can certainly make sure that with the clinic, we work to also balance that with the most economical set of products. And I think we wouldn't need to go through some of the other items that we've talked about because it is a cash pay patient.
Perfect. How quickly are orders processed, Ryan? I know that depending on where your locale is, we've got 4 different time zones across the United States, or 3. I get confused myself. How quickly do you respond, and how quickly is everything shipped out to the patient? I know in your presentation you did say 2-day shipping, but what's the time frame from when an order comes in to when it's actually going to leave your office?
Yeah, it's a great question, Ira. If an order comes in, we're talking East Coast times. Our office is in Atlanta. Our warehouse and our shipping fulfillment center is in Atlanta. So we're talking East Coast. If an order is received by 2 p.m. during a weekday and the order has all of the complete information, that order will ship by 2 p.m. same day. that same day. But if it comes in with incomplete information, then we go through the process of obtaining that information, and it will ship as soon as we're able to complete it.
Okay. So I love the analytics that you have. I'm couching this next question that came in. You provide me a lot of information for the business side of my medicine. You allow me to track everything, but I've got a pretty efficient practice, and I run my own IVRs. I have my own documentation support through my billing company. I don't need you to do a benefit verification for me. I don't need note review. I don't need you to tell me how to populate my 1,500 forms. My billing service does that. I trust them. I just want supplies shipped. Convinced to be used if I just want to use them as a conduit to ship supplies and medically necessary products that my patients need.
Yeah, Ira, I think it's a fair question. The short answer is yes. The longer answer is I think there are lots of folks that can ship product. This is more of a comprehensive offering. We're happy to work with any and every clinic and absolutely can provide all of that inventory in a very efficient way, in a way that I think would add great value to those clinics. Yes.
Awesome. I've got one last question here.
Okay.
It says, I'm thinking, the question is, there are multiple different companies out there that I've seen that offer same or similar type service. How is Vista different from the other competitors in the marketplace?
Yeah, Ira, I think that probably the most significant issue or the most significant offering is that chart note review service. Our team is deeply experienced in all of the coding. They stay abreast of all of the changes in coding. They are very, very familiar with wound care specifically. They understand what notes need to look like. They understand what diagnostic codes need to be present so that all of those items match, that they will pass an audit, that they will be paid, and that they are compliant. That is a fairly robust offering, and I think it is probably the single most important differentiator.
Awesome. Well, Ryan, you've done a great job, and I'm out of questions. Do you have any closing comments that you'd like to make?
Ira, look, we're thrilled to be part of what you guys are doing on a Tuesday night. I think that the work that Taylor does really provides incredible value to its members. And I would say this: if anyone is here tonight who has more questions about the offering, more questions about the details, you're curious about how we might be able to help your practice, please reach out to me, reach out to Ira. We are always happy to talk further.
Thanks, Ryan.
It's my pleasure. Thank you, Ira.
We have our next Tuesday, Taylor Tuesday webinar coming December 9th. Our Taylor vendor partner is going to be Alleviate. I love using them. I've used their products since we were introduced to them for myself. They make musculoskeletal pain relief accessible to everybody. They design and make self-treatment systems for specific common chronic pain pathologies. They combine digital and physical technologies, and they do direct to customer. As we talked about, costs are going up, reimbursements are going down. Alleviate offers a cash product to patients to help with treating difficult medical and musculoskeletal conditions. So we're looking forward to having them on in December 9th. I also want to let anybody know that if they want to contact us, this is my personal cell number, my email address. We have our website. Our team is always available to help you. And Ryan, I know you're not going to believe this, but I am just a few minutes late, but the Northern Lights are passing over the mountains right off my deck. So I'm going to go look at the Northern Lights as they're passing over the mountains now. And I want to thank you very much for taking the time away from your family. And I want to thank everybody who joined us tonight. And I am going to stop sharing, and I'm going to get ready to close down. And I'm going to thank you for joining us, Ryan, and thank everybody for joining us. Look forward to seeing you December 9th.